All right, October is Domestic Violence Awareness Month. Safenest and Intermountain Healthcare are teaming up to stop what is an epidemic. Joining us to talk about their efforts to stop domestic violence, we have Liz Ortenburger, who is the CEO of Safenest, and Kerry Palakanis, who is from Intermountain Healthcare. Thank you both for joining us today.
Thank you.
Palakanis. I practiced that beforehand and still messed it up. Thank you both for joining us today. Let's talk about some of the efforts you have going on as this is Domestic Violence Awareness Month. What are some of the key things that you have done teaming up together?
Yeah, so Intermountain has been incredibly generous with Safenest and actually helped us launch the Coaching Boys into Men and Athletes as Leaders program 2 years ago, which we have got intensive work going on in charter and private schools throughout the Valley, helping coaches understand how they can have conversations of consequence with the young men and young women in their locker rooms.
I love that. And Kerry, you guys have done studies that show that this plays into overall health when it comes to families.
Absolutely. Unfortunately, domestic violence, intimate partner violence, is a symptom of the dysfunction that occurs in the social dynamics in families. And without organizations like Safenest, our individuals in our community would be lost.
And it is heartening to hear, Liz, that we're working on the ground floor here with kids who obviously are going into adulthood and will eventually be in such situations, because the role models have not been fantastic sometimes when it comes to athletes.
No, and the stats are really clear. 76% of kids growing up in households where domestic violence is present are going to repeat that cycle as victim or as abuser. That's the generational studies that we look at. And so really ending domestic violence starts with young people. The Coaching Boys into Men and Athletes as Leaders program, 95% of the young people in sports will be leaders in companies and in our communities in the future, empowering them with understanding their context as young people, but also the changes they can make in their workplaces and their communities as adults. This is how we start to end generationally these trends.
And it is sobering to find out how ubiquitous domestic violence is. You have done studies on that as well.
Yeah, across our valley, 43% of women have been affected by domestic violence, 37% of men on the survivor side, on the victim side of that. We know many more men have been affected and women as abusers as well. And so really working with Intermountain allows us to start to create a holistic approach, particularly looking at things like strangulation and some of those determinants that could have lifelong effects for a survivor but are going fairly undetected today.
Well, thank you both for your efforts, and we really appreciate you being here today.
Thank you.
Thank you very much. We want to thank Intermountain Healthcare for sponsoring this segment. If you'd like more information, you can visit safenest.org and intermountainhealthcare.org/Nevada. We'll be right back.